It was October of 2006 when I met her. I was early on in my training to become an ICU doctor working at Boston Children's Hospital, and she was my patient. As we say in Boston, she's wicked cute. Jordan had been through a lot in her short life so far. She had been born with a rare liver disorder and had undergone a liver transplant as a small baby. This time she was admitted to the hospital with a pneumonia. It was a Saturday night when I was taking care of her and I went in to check on her, pleased to see that her condition had improved since the last time I had seen her. That night I had the luxury of a few extra minutes, so I spent some time in her room getting to know her family, even played with her for a few minutes, because that's what we do at a children's hospital. We play with the children. It's pretty awesome. But that bond actually made what happened next even more difficult. About 10 minutes after I left her side, a code blue was called. It was Jordan. We all rushed into a room to the most horrific sight you've ever seen. This beautiful girl was lying in her bed, lifeless, pale. Her heart had stopped beating, and her face was covered in blood. She had suffered a rare and devastating complication of pneumonia in which one of the arteries in her lungs had ruptured. Blood was gushing into her airways, preventing oxygen from getting to her bloodstream. Immediately, a colleague and I rushed to the head of her bed. I worked feverishly to clear the blood from the back of her throat so that he could see clearly to place a breathing tube into her windpipe. As soon as we got the breathing tube in, we attached a bag and a mask so that we could give her as big a breath as possible, packed with as much oxygen as possible into her lungs. The nurses gave her medications to help her heart start beating again, gave her blood transfusions, all the while performing CPR. And yet, despite all of this, the oxygen level in her blood was so low that we knew her heart would not start beating again. Desperate to save her life, we decided to put her on an emergency form of heart-lung bypass called ECMO. This machine would take her blood, pass it over a membrane to give it oxygen, and then pump it back into her body. It was foolproof. The only problem is that this required the placement of cannulas, which are like huge IVs that go into your blood vessels. And this required delicate surgery. So we were literally doing CPR and surgery at the same time. Well, eventually we were able to get her onto this machine. Her oxygen levels did come back to normal, and her heart started beating again. But a few days later, we learned that although we had all done our very, very best, our best had not been good enough. The few minutes that Jordan's blood levels of oxygen had been low had caused irreversible and severe brain injury. Jordan would never be the same again, and she died a few days later. I was crushed. How could this happen? How is it possible for her to be surrounded by every resource known to man? She was in a great hospital, in an intensive care unit. We had an ECMO circuit and a really good surgeon. And still, we had no way to get the small amount of oxygen that her brain needed to survive intact while we stabilized her. And so that night that she died, I laid in bed and I legitimately asked this question. Why couldn't we have just put oxygen into her IV? Surely that couldn't be impossible, or could it? After all, the last step you take before you attach anything to an IV is to make sure that there are no gas bubbles in it. Everybody knows that even a small air bubble in your bloodstream is enough to cause a stroke or a heart attack if it's in the wrong place. But what if that gas was partitioned into tiny microparticles? Each one small enough to pass through your bloodstream without causing these problems. Wasn't somebody working on that? Well, I couldn't sleep, so I did what I suspect any reasonable person would do at 3 o'clock in the morning with a crazy idea like this. I got out of bed, I turned on the light, and I Googled it. And to my surprise, I found that ever since the 1980s, People had been developing gas-filled microparticles that were being used as ultrasound contrast agents. These particles were just the right size, they had a coating around them, and they were filled with a gas. But nobody was using them to deliver gases to the bloodstream. Still curious, I decided to reach out to some of the scientists who had published in the field. Several wrote me back, and I began a conversation with one who was particularly helpful in the beginning. I remember the first conversation I had with him. I asked him, "Do you really think you can fill these microparticles with oxygen?" He said, "Oh yeah, of course I can. I did my entire PhD thesis on that." I was so excited by the confidence in his answer that I actually asked him something ridiculous next. I said, "Well, if that's the case, why didn't you make it a drug?" His response to me was as enlightening as I could have ever hoped. He said, "I didn't know that would be useful." And that's only to tell you that sometimes people who can create amazing solutions are actually completely unaware of the real problems we face as clinicians every day. At that point in my journey, it was also important for me to find someone at my own institution who could help me think about this problem. Someone who believed in me enough to invest in me and would give me a place to get started. That person was Frank McGowan. He was an accomplished researcher and a respected anesthesiologist. He really took me under his wing and taught me how to do research. So together, the three of us decided to start with the simplest experiment. Could we take oxygen-deprived blood, like that which had caused my patient's brain injury, and fill it with oxygen just by adding microparticles to it? That sounds simple enough, right? Well, that experiment took us more than a year to get right. I remember it was late on a Friday night when I should have been home with my wife, but instead I was in the lab working on our latest formulation of microparticles. When I was ready to test them, I realized that I had no blood left to test them on. So I called my mentor, Dr. McGowan, and I asked if he would be able to draw some of my own blood to test the microparticles on. So normally when we did this experiment, the microparticles, which are white, would actually sit in a clump on the top, or they would sink in a clump to the bottom, but the blood would always stay blue, which is what blood that has no oxygen in it looks like. But this time, it turned red. That was our first taste of success. Well, now I'm going to fast forward 5 years past many frustrations and hundreds of failed experiments. We had a bigger team then, including different engineers who would help us overcome some technical hurdles that we had encountered, and we were able to manufacture a syringe that looks like this, which contains more than 1 trillion microparticles filled with oxygen gas. To test it, we created an animal model that closely mimicked what had happened to my patient that fateful night. At the beginning of the experiment, we blocked the breathing tube of the animal so that they couldn't take a single breath in or out for 15 minutes. In animals that we treated, according to today's standard of care, oxygen levels dropped so low that their hearts stopped beating between 6 and 10 minutes into the experiment. At the end of 15 minutes, we unblocked their breathing tubes and allowed them to start breathing again, and those surviving animals all had severe organ injury, just like my patient. But in animals that we treated with microparticles, oxygen levels were sustained, such that all but one animal survived for the entire 15-minute period without a single breath. Some of them even had normal oxygen levels at the end of 15 minutes, and none of them had organ injury. Now, we still have a very long ways to go, but this was an important step towards solving this problem. Unfortunately, patients like Jordan die every day from one cause of hypoxia or another. A successful project here would mean that any patient with an IV would be able to be rescued from life-threatening oxygen deprivation. Now, of course, we'll have to overcome and address concerns about the safety of injecting a gas into the bloodstream. I'll give you that. And oxygen itself is a very potent molecule, and too much of it, given at the wrong time, can be equally as harmful as a deprivation of oxygen. But in the end, I believe these are solvable engineering problems. And this project might actually have implications for fields outside of medicine. For example, could you add microparticles like this to fossil fuels to enhance their efficiency? Well, as a final message, I'd like to give a word of encouragement to the people in this room or people listening by the web who may have thought of a new approach to a problem, but you don't know where to get started. Maybe you don't really think of yourself as a researcher. Or maybe somebody else actually discouraged you from pursuing this approach to a problem. Maybe you hear questions of self-doubt. Who do you think you are to try something new or try something hard? That's for somebody else to do. But listen to me. If you have that vision, then you have to be the one to take what people consider impossible or even foolish today and turn it into tomorrow's breakthrough. So if you believe in your idea so much that you want it, you know what I'm talking about? That deep want inside that makes you think about things at night and on weekends, and sometimes even when your wife is talking to you. That's not good. I don't condone that, by the way. Then be disciplined in your approach to the problem. Commit your ideas to paper. Write a grant. Have the courage that it takes to present your ideas to the people more accomplished than you. Anticipate the hurdles that you will encounter. And build a team around yourself to help you overcome them. And most importantly, be persistent as you drive towards your goal, and don't give up till it gets done. Because if you do this, you just might become the reason that patients like Jordan will be better off tomorrow than she was yesterday. Thank you.